What happens if you miss a dose of Buspirone? Have you ever wondered what to do if you forget to take your Buspirone? Missing a dose can happen to anyone, and knowing how to handle it is important for your mental health management. So, what should you do if you miss a dose of Buspirone? If you realize you missed a dose, the general advice is to take it as soon as you remember. However, if it is almost time for your next scheduled dose, it is best to skip the missed dose. Continuing with your regular dosing schedule is the way to go. It is important not to take extra medicine to make up for the missed dose. Doing so could increase the risk of side effects or even an overdose. Buspirone is primarily used to treat anxiety by affecting neurotransmitters in the brain. Missing a single dose usually does not lead to serious issues, but it may temporarily reduce the medication's effectiveness. Consistency is key to maintaining stable levels of the drug in your system, which helps manage anxiety symptoms effectively. When considering substance abuse and addictions, it is worth noting that Buspirone has a lower potential for dependence compared to other anxiety medications like benzodiazepines. However, if you miss doses frequently or stop taking Buspirone suddenly after long-term use, you might experience withdrawal symptoms or a return of anxiety symptoms. Withdrawal symptoms can include nausea, dizziness, fatigue, irritability, and increased anxiety or panic episodes. If you miss doses often or stop taking the medication suddenly, especially after using it for a long time or at high doses, the risk of withdrawal symptoms increases. These symptoms can last from several days to weeks and may involve emotional effects like irritability and mood changes, as well as physical effects such as muscle cramps and headaches. For those managing Buspirone in the context of addiction or mental health treatment, it is advisable to follow the prescribed dosing schedule closely. If you find yourself missing doses repeatedly or considering stopping the medication, consult your healthcare provider. They may recommend a gradual tapering of the medication to minimize withdrawal symptoms and reduce the risk of relapse into anxiety or other symptoms. In summary, if you miss a dose of Buspirone, take it as soon as you remember unless it is close to your next dose. Do not double up on doses. Missing one dose is unlikely to cause severe effects but may temporarily reduce anxiety control. Frequent missed doses or sudden discontinuation can lead to withdrawal symptoms and a return of anxiety. Always reach out to your healthcare provider for guidance if you miss multiple doses or plan to stop taking Buspirone.